Good afternoon. My name is Varanya. I hope you and I are having a lovely day, everyone. I went to uni today for my nursing lesson. Today we're learning about SBAR Tools. SBAR Tools. SBAR is short from Situation, Background Assessment, and Recommendation. We use SBAR when we do patient observation as a nursing student. If patient score, we then use SBAR SBAR tools to escalate. I will explain a little bit more about SBAR tool, situation, background assessment, and recommendation in a minute. But first, I want to explain about how we do the observation on the patient when we on our placement as a nursing student first. As a nursing student, you will also get involved with doing the observation on the patient when you are on your placement. When we do the observation on the patient, we will check patient respiration, patient saturation, patient breathing on room air or on oxygen, checking patient blood pressure, checking patient pulse rate, checking the consciousness level of the patient, and also checking patient temperature. This observation we call A, B, C, D, E. So this will be part of your OSCE as well if you are a nursing student. The observation using A, B, C, D, E will be part of your OSCE exam. So SBAR tool will be part of your OSCE exam as well. So according to Royal College of Physicians, your normal respiration rate, which is your A and B, will be between 12 to 20. And your saturation, which is also part of your A and B, will for the normal rank according to Royal College of Physicians, it will be 96 or above. But 96 to 100, the saturation will be only from 0% up to 100, and 96 or above, 96 to 100 will score 0. Will class as normal saturation rate according to Royal College of Physicians. For the nursing student, you will not using saturation scale 2 on your exam. You will only using the normal scale 1 for the saturation. When you assess patient for the saturation rate, you will also need to state that patient breathing on room air or patient on the oxygen, such as you saying, oh, my patient saturation is 96% on room air. Yeah. And then when you checking patient respiration, you will say my patient airway is patent, because they can tell them their name, their date of birth. They can tell me their name, their date of birth, so their airway is patent. And then when you check, before you perform the observation on the patient, you will ask patient their name, their date of birth, gain their consent for them to allow you to do the observation on the patient. First of all, you introduce yourself, say who you are, such as my name is Varanya, I'm a student nurse. Can you confirm your name and your date of birth? Yeah. And then when patient tell you their name, their date of birth, and then you ask them, do you know where you are at the moment? You know, if patient can tell you they're in the hospital and they can tell you the name of the ward, then patient is alert. Yeah, that's the level of their conscious. They alert. Then you ask patient, can I check your respiration rate? Can I check your saturation? Can I put sat probe on your finger? You know, can I check your blood pressure? You know, can I count your pulse rate? You know, and then can I check your temperature? You know, so normal blood pressure will rank between 111 to 140. That is classed as normal blood pressure. So anything below that or anything above that, you would want to escalate it to the qualified nurses. For pulse rate, according to Royal College of Physicians, the pulse rate, normal pulse rate will be between 51 up to 90. Anything below that or anything above that, you would like to escalate it to the registered nurse. Yeah. For the blood pressure, if anything above 140, you would like to escalate, because sometimes if blood pressure around 160, 170, you would the patient will class as hypertension. That's when you need to escalate patient to the registered nurse. Also, when you check patient temperature, you need to ensure your tympanic probe is clean all the time. Yeah. Once you use once you use the tympanic probe, you need to discard it in the bin and then clean the tympanic probe and put it in place. The normal temperature, according to the Royal College of Physicians, is in between 36.1 to 38. But if anything above 37.5 to 38, you would like to escalate it to the nurse anyway. If you remember what happened during COVID, any patient that temperature above 37.5 up to 38, you escalate it anyway, even if it's not above 38, because in case the registered nurse, she might want to recheck it. Sometimes when a patient score, such as when patient have a respiration rate 24, you know, then patient is score 2 because of the respiration. Then you need to escalate it to the nurse, and then the nurse might tell you, or you need to recheck again in around 4 to 6 hours, you know, or the nurse might recheck the respiration on that patient herself before you can save the new score or save that observation. At the moment, this paper-based is a lot of hospitals, they no longer use the paper-based. They now turn to digital version. But according to that, before you save your observation, you might want to show the screen to the registered nurse or to see what the result of the observation if patient score. However, you need to remember the figure. What is a normal figure for respiration? What is normal figure for saturation? What is normal figure for blood pressure? What is normal figure for pulse rate? Or what is normal figure for temperature? That's the reason why this paper-based sometimes is useful. I know they're still using it over maternity unit. They're still using paper-based. But in some general ward, inpatient ward or elderly ward, they now turn digital. So before you save your observation chart, if patient score, you might want to show that the screen of your digital version to the registered nurse before you save your observation. However, with the new score, you round the back of the new chart, it will tell you if patient score 0, you then need to recheck it in a minimum of 12 hourly. Or if patient score 1 to 4, you recheck minimum of 4 to 6 hourly. So if patient score 3 in a single parameter, then you need to escalate it to the nurse in charge or the registered nurse immediately, and then the registered nurse will then will tell you if she wants you to repeat the observation on that patient. The same apply to the patient score for 5 or more. You also need to have the urgent response on that. You need to inform the registered nurse straight away, telling the registered nurse the patient score 5 or patient score 3 in one parameter, and then the nurse, they will maybe double check the patient observation themselves, or they will tell you to repeat it in 15 minutes or 30 minutes. So they will tell you anyway, the registered nurse will tell you. Sometimes we have patients that score 6, 7, 8. Then you need to, when patient score 7 or more, you need to act as an emergency response. You have to tell the registered nurse straight away, and then continue monitoring the vital signs. When the patient starts to score 1 or more, that's when you start to using SBAR tools to escalate. SBAR tools, it's short for situation, background assessment, and recommendation. The situation, it could be when you want to explain the situation, when you escalate, you tell the registered, you will tell if you call the doctor, if you call the doctor to escalate the patient of the if your patient score and you want to escalate to the doctor using SBAR tool, which is situation, background assessment, and recommendation, you then need to normally the nurse will call the doctor if patient score 3 in one parameter or 5 or score 5 or above. You will need to give the situation to the doctor, saying, "Hello doctor, my name is Varanya, I'm a student nurse. Yeah? I'm concerning about my patient. His name is Mr. X. He's a 55 years old male admitted to the GI ward with recurring bowel obstruction. Yeah? He has been experiencing vomiting regularly for the several hours despite the use of emetics." And then for the background, you need to explain to the doctor that this patient has a past medical history of atrial fibrillation, yeah, Crohn's disease, hypertension, blah blah blah. And then for the assessment, you will then need to tell the doctor that I have done the observation on the patient. His temperature is 37.5. His blood pressure 90/60, despite he has a past medical history of hypertension, but at the moment his blood pressure is 90/60. And then his pulse rate 110 beats per minute, his respiration rate 22 beats per minute. He's alert, and then his saturation 97%. He's breathing on room air, and then his new score total is 6. And then you need to ask for recommendation from the doctor, saying, what do you want us to do at the moment? Can you review the patient for us to see what we can do next to help the patient or to treat the patient. Then the doctor, they will tell you what they want you to do. They may prescribe patient with the fluid, because he can't have anything orally because he's been vomiting and his blood pressure is low, so he can't eat, can't drink, so he now have to be nil by mouth, so the doctor will tell you, oh, I'll prescribe him with some. If the patient will if you ask the doctor, can you review the patient and what you want us to do at the moment? So the doctor, they will then review the patient, and then they might tell you, oh, I'm gonna prescribe the patient with some fluid. Can you keep the patient nil by mouth for the moment because he's been vomiting? Yeah, so he can't have anything orally. So that is something that you can do to help the registered nurse while you're on your placement. Anyway, I will repeat it again in my next video. So it is a lot to remember, so on the figure. You can't remember it in one day. It needs a lot of practice. More practice make perfect. In the clinical practice, more practice make perfect. So what I have just said, you may not be able to remember it in one day. So I'm gonna repeat it again in my next video. In my next video, I will repeat it again of new score. What new score stand for? New score stand for National Early Warning Signs on the vital sign you check on the patient when you do the observation on the patient during your placement as a student nurse. And then SBAR Tools is also stand for Situation, Background, Assessment, and Recommendation. That's when you need to escalate the patient to the registered nurse and the doctor if your patient score. So now is my time to have my evening meal, guys. I got here right in front of me egg salad. I went to the gym today, so now I'm gonna having egg salad. On your OSCE exam, from my practice and from the lesson I have learned, before you start the assessment on your patient, you will want to check the environment in the patient room to see if the environment is safe for you to start the assessment on the patient. You might want to say it out. Before I start my assessment on my patient, I have checked and observed the patient environment. There is no obstruction, no hazard that will prevent me from doing the assessment on the patient. And then you will want to say it out. Then I'll close the curtain to give patient privacy and dignity. I gel my hand and wash my hand. But on this occasion, I will not wear gloves or apron because I will not touch any bodily fluids. Plus, my patient has no infection. And then I enter the room. I introduce myself to the patient, like Good afternoon. My name is Varanya. I'm your student nurse. Can you confirm your name and your date of birth, please? Yeah. Then patient confirm the name and date of birth. Can I check your name back to see if your name and your date of birth is correct? Yeah. And then you gain consent from patient. Is it okay if I check your respiration rate, Mr. X? And once you finish counting your patient respiration rate, then you said, my patient Mr. X, his respiration rate is 12. According to Royal College of Physicians, his respiration rate is fall in a normal range of 12 to 20. And then my patient airways patent because he can tell me his name, his date of birth, and he also can tell me where he is. And then you will ask the patient, Mr. X, is it okay if I check your saturation? Is it okay if I put a sat probe on your finger? And then he'll say, yes, go. And then, so he put the sat probe on his finger. In the real practice, you may not all the time see nice and alert patient. Sometimes you have the confused patient, so they might tell you, oh, don't touch me, go away, and then you might want to tell your patient, that's okay, Mr. X, I'll come back to you when you feeling better. Yeah. I'll come back in about 10-15 minutes when you feel better. Then 15 minutes gone, you come back to him again and ask him, Mr. X, is it okay? I check your saturation. Is it okay if I put a sat probe on your finger? Then he might say, oh, go on then, And then you check his saturation. Then if saturation is 99, then you say, oh, my patient, Mr. X, his saturation at the moment is 99 on room air. Yeah. But if your patient on the oxygen, you also might want to say, my patient saturation is 99% on 1 liter of oxygen. But most of the time on your OSCE exam, you will be just be on room air. And you're only using scale 1 in your OSCE, you're not using scale 2. Then after that, you ask your patient, Mr. X, is it okay if I check your blood pressure? Then he'll say, oh, go on then, get it over and done with, And then you say, oh, thank you, Mr. X, and then you check his blood pressure, And then when his blood pressure come out, 120/60, Mr. X, your blood pressure is 120/60. It is fall in a normal rank according to Royal College of Physicians. Then the next thing, you want to check his pulse. So you ask him again, Mr. X, is it okay if I check your pulse? Then he will say, oh, anything else, anything else you want to check on me? Go on then, get over and done with, So you say, oh, thank you, Mr. X, and then check his pulse, Despite he being agitated, but his pulse is 60. So Mr. X, your pulse rate is 60, So it is now, it is fall in a normal rank according to Royal College of Physicians, And then you ask him, Mr. X, you know where you are? He said, of course I know, I'm in the hospital. What, GI, So I said, oh, thank you, Mr. X, And then you saying my patient is alert because he can tell me where he is correctly. Yeah. And then you do the last thing, you're checking his temperature. So you ask him, Mr. X, is it okay if I check your temperature? And then he will tell you where you want to check my temperature. In my mouth, in my ears, Then say, can I put the probe inside your ear, please, Mr. X? Then you say, oh, go on then, Then you check his temperature. Then his temperature, 37.1, despite he being agitated, So you tell him, Mr. X, your temperature is 37.1. According to Royal College of Physicians, your temperature is normal, And then you total the new score, he scores 0. So you tell him, Mr. X, at the moment you ask your new score is 0. We have no concern on your we have no concern on you at the moment. I will save the observations. I will save the new score, and then I will come back to check on you in about 12 hours. Thank you very much, Mr. X. That's your OSCE done. He scored 0. You don't have to escalate. So in next time, I will talk through the patient, maybe name Mr. X again, if he score, and then we'll see what we're gonna do. For the pediatric, if you are pediatric nurse, they will using PEWS, PEWS. PEWS is a pediatric early warning sign. With general ward, if you adult nurse or mental health nurse, they will use a NEWS, NEWS, NEWS score, which is a national early warning sign. Once you start to doing it every day during your placement, you will then start to get used to it. Next time I will talk you through when the patient is score and why they what normally cause them to score, and why this type of patient most likely to score more than others, things like that. It's only from my work experience, you know. Sometimes when I have patients that score. When you can't remember on a figure, on a news chart, you know, because the figure on a news chart may not be too much to remember when you first start your nursing journey as a student nurse. You could just show the screen of your Dynamap to the nurse before you press save, you know, because nowadays they convert the new chart from paper based into the digital version. So you would like to show the nurse your Dynamap screen before you press save it. If patient score, if patient not score the new score, which is 0, you can just press save it. But if patient score 1 or more, if patient score 1 or more, you might want to show your Dynamap screen to the registered nurse. She might want to recheck the blood pressure herself, or tell you to recheck it and how you can recheck it to improve the score, you know. But remember, a patient score escalated to the registered nurse that working with you is very important, because if anything does happen to that patient that's scoring and you not escalate, it could come back to you. Remember, it is part of your nursing practice is accountability in your nursing practice, you know. You do the blood pressure on the patient score, and you not escalate, you accountable to your action. You could end up in court, patient score 3 or 5, patient score 3 in one parameter, or patient score 5 or above, and you not escalate. And if something does happen to the patient, you could end up going to court, if you not escalate. You might want to know why it's so important for us as student nurse to know how to do the observation on patient, because this is the only way we will know what's going on with our patient. They're sitting in the chair, you won't know what actually going on with them. If you do the observation, you're checking their respiration, their saturation, their blood pressure, their heart rate, their temperature, then you might know if they become unwell or they got infection. If they have low blood pressure, it could be because they dehydration. They because some patient they need feed, they then have low blood pressure. It could be because they're lying there in bed, no one feed them with waters and food. They become dehydrated, and then they might need help with eating and drinking, or they might need IV fluid, If your patient is vomiting and low blood pressure, you inform the doctor. The doctor might tell you to put patient new by mouth, and then they prescribe patient with fluid to increase their blood pressure. In my next video, I will talk more about OSCE practice, what we done during OSCE practice as a student nurse. If anyone preparing themselves for OSCE, in my next video I will talk more about OSCE practice. Because OSCE is very important. Normally, student nurse in the UK, they're doing it during their first year. They get their OSCE completed first before they start their first placement. That's what happened at my uni anyway, University of West London. We get our OSCE done first, pass our OSCE, and then we start our first placement. Only because you need to know on how you do the observation on a patient and how you escalate if the patient scoring. Sometimes when you're on the ward, patient tell you, I feel sick, you know, I'm feeling dizzy, I feel sick. You might want to tell the nurse the patient say they they're feeling dizzy and they feel sick, and then you do the blood pressure, checking the blood pressure, do the observation on the patient straight away, and then inform the nurse or patient new score, you know, and then the nurse can escalate to the doctor using SBAR Tools, which is a situation, background, assessment, and recommendation. Life as a student nurse is fun, guy, especially when you will be on your placement. That will be more fun, you know, because you get to do the work that you will be doing when you qualify, you know. Nowadays in America, guy, they have new car brand coming out called Escalade, you know. Very expensive, you know, Escalade car. You used to have Lamborghinis and Ferrari, which is very expensive car. Now you have Escalade, you know, very expensive car. So as a student nurse, use Escalade, guy. If people ask you, you are a student nurse, you drive, say, of course I drive, you know. What car you use, you know, what car you drive? I drive Escalade, you know. So thank you very much everyone for watching. Next time I will talk you through in more detail of our OSCE practice, new score, SBAR tool. Today I'm talking about when I'm talking about the situation where patient not scoring. So next time I will talk you through the situation when patient scoring, and then what we will do when patient scoring. So thank you very much everyone for watching. I hope you and I are having a lovely day. See you next time. Bye bye.